So what is a bunion? It is basically a bony prominence that develops over the joint at the base of the big toe. Clinically, it is known as hallux abductor valgus, which refers to the deviation of the hallux or the big toe towards the smaller toes. Bunions are commonly associated with pain, redness and swelling, and down the track osteoarthritis can develop in that joint, as well as a reduction in the motion of that joint. So what causes a bunion? Bunions can occur due to a variety of reasons, but essentially it comes down to incorrectly or overloading the joint where it forms. Some of the more common reasons are genetics, so if you inherited that foot type from your parents, tight toe boxes on shoes or high-heeled shoes, and poor foot biomechanics. So a foot that excessively rolls in is more prone to a bunion due to overloading that joint. So what are the symptoms of a bunion? So the most obvious symptom is a bony bump on the outside of your foot there at the base of the big toe joint. This can be accompanied by pain, redness and swelling, but not always. You can also develop corns and calluses over that area due to the excessive loading of that joint. How do you diagnose a bunion? So your GP or podiatrist should be able to diagnose the bunion simply by observing your foot. They may do some assessments with you seated and testing the range of motion of that joint, and they may also do some assessments with you standing and checking the functionality of that joint. They may decide to send you for an x-ray just to see how bad it is, and also if there's any osteoarthritis developing in there, but it's not necessary for diagnosis. So what are the treatment options for a bunion? As podiatrists, our treatment options are generally conservative, and these look at slowing the progression of the deformity rather than reversing it. So these can include footwear recommendations, so footwear that have wider toe boxes and a lower heel. And if poor foot biomechanics are at play, then we might suggest custom orthotics to correct the foot biomechanics. Intrinsic muscle strengthening is another one that might be recommended. And night splints have shown to offer some improvement to correct that deformity. Worst case scenario, if there's a lot of pain and a lot of deformity, surgery might be considered.